Elder Care. Hey, listen, you've been invited to attend your granddaughter's wedding. It's out in Arizona. You haven't flown in 30 years. Last time you spent the night somewhere was 28 years ago. You're a little stressed right now. But you know what? Dr. Alicia Abaje from Johns Hopkins School of Medicine packed a little travel list. Calm us down, will you?
I'll try my best.
Man, what do we need? What do we need? What do we need?
Well, it's really important because as people get older, there's just more to keep straight. More medical conditions, more medications, and more doctors to keep all straight. So what I put together is a list of a few things that people should have with them. So there's two types of medical information that older adults should have with them. The medical information that's most important is a list of their medical conditions. They should talk to their doctor to help them put this list together. But on that list should be their medical condition, the state that condition is in, and what they're doing about it. So I'll give you an example. If you have high blood pressure, on your list should be high blood pressure. Normal blood pressure for me is about 120/80, and I'm taking 3 medicines and following a low-salt diet.
No kidding.
So that would be one thing. That detail, why is that important? Well, one, it's important for you to know where you're at with your medical conditions, but if you go to an unfamiliar setting and end up, God forbid, in a hospital or an ER, they're going to need to know that information to better take care of you.
So this is the medical information. What do you want it on? An index card or written down? Doesn't matter what.
Doesn't matter. Some people keep it on in a little journal, a little notebook. It doesn't really matter how you do it as long as it's there. And in addition to those medical conditions, you should make sure you have your list of medications. Not just the list of what they are, but the generic name, the dose, the frequency, and why you're taking it. So those are the two most important things to have in terms of medical information.
Are you talking about the medications? If you're on diabetes, you put that down. Congestive heart failure?
Right. So with congestive heart failure, that's very important. If you have congestive heart failure, that goes on your list. But in addition to that, you should say what your heart normally pumps at, which your doctor can give you that information, what percentage, and what your normal weight is for your congestive heart failure.
I was just going to get to that. Normal weight, and also what contact information should I carry?
Very important. So in addition to your healthcare provider's contact information, you want your insurance information with you. You also want the pharmacy that you normally get your medicines from, and most importantly, you want the contact information for your healthcare agent or the person that helps you make decisions on your behalf in case you're not able to do so.
Now, you also said additional items.
Right.
A bathroom scale?
So these are depending on what conditions you have. So for people who have congestive heart failure, you should have access to a bathroom scale wherever it is that you're going because you need to monitor your weight. And so that's why that's important for that particular population.
Eyeglasses?
Definitely for everybody. You need to have your eyeglasses, a spare with you. You need to have your hearing aid supplies if you wear one, and your dentures. Very important basic things that can keep you sane.
And you also say pack a blood pressure.
Yes, a blood pressure cuff, or have access to one when you're there if you suffer from high blood pressure or have any problems with your heart, because monitoring your blood pressure while you're awake can help explain why you may not be feeling well.
But most of us just pack and say, nothing's going to happen, I'll be all right.
And let's hope that's the case, but better to be prepared.
Well, thank you so much, Dr. Abaje from Johns Hopkins. And say hello to your medical students now are following you.
Yes.
Man, you got a cult following
Karina's
now.
with me today.
Very nice. And Megan, she's got a cult following now.
She usually does.
She is so good, isn't she?
I know. If it's not her mom, then it's, you know.
Are you packing anything for the wedding? Anything that you mentioned? Bathroom scale?